This is Talk to KEDI, sharing knowledge, liberating minds. Hello, thank you so much for joining me on another edition of your #1 educational online broadcast, Talk to KEDI. Our topic of today is polycystic ovary syndrome, also known as Pcos. In other words, we will be talking in details what polycystic ovary syndrome is, the causes, symptoms, how people who are susceptible to this ailment, how it can be effectively treated, or the preventive modes, as well as how you can either treat or manage this ailment. My name is Felix Adedoyin. Stay tuned and welcome, and let's get ready to learn together. In the studio with me today is one of our seasoned distributor and a highly respected KEDI lecturer with a wealth of knowledge in traditional Chinese medicine. His unique expertise bridges modern health awareness and century-old Chinese wellness practices, offering practical insight on how natural remedies, lifestyle balance, as well as holistic approaches can help women manage PCOS more effectively. Please join me with a digital applause in giving a warm welcome to Mr. OPEYEMI AKANO. Thank you so much. Welcome to Talk to KEDI, sir. Could you introduce yourself to our guests, our viewers at home?
To all lovers and KEDI distributors throughout the world, my name is Akanwo OPEYEMI. I'm the KEDI Star 8 consultant, also a KEDI lecturer, and I also practice in natural medicine.
Wow. You're welcome, sir. Thank you so much for coming. We are so delighted to have you on the show once again. If you're tuning in for the first time, this is Talk to KEDI, your #1 educative online broadcast, brought to you by KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and services in Nigeria. Welcome on board and stay tuned. Today, we are discussing polycystic ovary syndrome, also known as what? PCOS. One of the most common hormonal disorder affecting women of reproductive age. The goal of this edition is to create awareness, provide accurate information, as well as for us to discuss how women can manage PCOS for a healthier life. So now let's go to our statistics. According to research published in September 2024 by the Global Body of Disease, what did they say? As you can see on my screen, PCOS affects about 6 to 13% women of reproductive age worldwide. This is very, very alarming. The data also found revealed a global prevalence of 867.7 cases per 100,000 women that were tested. Also, women with PCOS are 4 to 7 times more likely to develop type 2 diabetes and are also at higher risk of infertility, obesity, depression, and cardiovascular disease, hypertension, among others. I also have that around 70 to 80% of women with PCOS experience infertility due to lack of ovulation. We call it anovulation. And up to 50% of women with PCOS are also reportedly undiagnosed. And this is often due to the delayed recognition of the symptoms around PCOS. This is very, very serious. But Mr. OPEYEMI,
Yes,
I'd like to ask you, with what I have, the statistics that we have, what in your own clinical experience,
okay.
how accurate will you say that these statistics are?
Well, very accurate, because if you are to look at the society, typically we can also see the rate at which people are suffering from infertility increases almost every daily basis. And I think it's a call for concern And one of those things that causes infertility mostly is PCOS. So I think we are saying the right thing here, and I believe people will be able to grab one or two things from today's program.
Wow.
Thank you, sir.
He said it all. Indeed, this is a topic, a discussion that you must not miss. All right, the show has started. Don't forget, you can be part of this show. You can be part of this conversation in the comment section. Let us connect. Let's share knowledge and also learn together. Click the link and share it with everyone that you know. Invite them to come. Let them join this broadcast of today as we learn about polycystic ovary syndrome, popularly called PCOS, about its causes, the symptoms, and how we can all treat or manage it effectively. If you have any questions whatsoever, now is the perfect time for you to start dropping in your question. Please rush to the comment section and drop it right now. And I can assure you that before the end of this broadcast, we are going to do justice to every of your questions. So, Mr. Penny, are you ready?
Okay.
All right. So I will take you to our first question, sir. The first question says this: what exactly is polycystic ovary syndrome (PCOS), and how does it affect women's reproductive health?
Well, I will like to make it very simple to understand, and not to make it so complex. Number one, in medical words, every word and statement has a reason and a meaning.
Yeah.
Poly means many.
Okay.
Polycystic, but I'm trying to elaborate it
To
now.
break the
So I
disease
think
down.
during that explanation, we'll be able to get it very better.
Okay.
Polycystic ovarian syndrome is poly, which is many. Cystic is talking about something that formed.
Yeah.
It could be liquid, it could be solid, something that formed, abnormal growth,
Yes.
rather. Ovary is talking about which particular part of the body is being affected,
Okay.
which is ovary now. Syndrome is talking about what are the symptoms that you will see. So PCOS is referring to abnormal growth in the ovary.
Abnormal growth in the
ovary.
ovary.
Yes.
Okay.
And the reason or the causes, one is hormonal changes. In our body, we are run by several things. And one of those things that controls our body systems is the body hormone. No, we can't do anything without hormone.
Yes.
So PCOS is one of the disease that let me call it metabolic disease, just like diabetes. It is not a disease caused by bacteria or caused by any other thing, but it's caused by hormone.
Hormone
So
disorder.
when the hormone that's supposed to be produced is either too low or too many, then definitely we're talking about PCOS.
Wow.
Thank you, sir.
All right, thank you. I'm indeed blown away with the definition of this, what PCOS means. So that takes me to our second question. You already talked about, you say, when you're talking about syndrome talks about the symptoms, things that you are going to see. So now that takes me to my second question, sir. What are the most common signs and symptoms that women should look out for when it comes to polycystic ovary syndrome?
Okay. I think earlier you asked, how does it affect?
How does the women of reproductive their reproductive health?
Of course it does, because we can't talk about fertilization or fertility as a whole without talking about the ovary.
Yes.
Because the ovary is the organ that is responsible for releasing eggs on monthly basis, which helps both for fertilization, for menstruation, for ovulation. So no ovary, no fertilization, because no ovary, no eggs.
Of course.
So if you are talking about fertility as a whole, we are talking about the ovary, because it plays a very crucial and vital role when it comes to fertilization. So it's very, very important. Now, to talk about how does it affect reproductive?
Women's reproductive health.
Of course it does, because so far the organ that's supposed to be responsible for fertility is being affected.
Yes, sir.
Then infertility is inevitable. It's just like you can't say you want to drive a car without a steering or steering wheel. It's not possible. Because the steering wheel is what will give the car the direction to follow. It's as simple as that.
Wow. So, what are the common signs and symptoms? You've not actually nailed that. The common signs.
All right. One, some illnesses, we call them asymptomatic, which means they show no symptoms. And that is one of the reasons why it is more, let me use the word, dangerous. But as time goes on, when it's becoming more serious in the body, there are some signs someone should look into. Number one is what we call amenorrhea, which is absence of menstruation. So when a lady has a complaint that's pertaining menstruation, PCOS is one of those things that should be looked into. Because people pay their attention mostly to fibroid, blockage of fallopian tube. Very few knew what PCOS is all about. And as a matter of fact, it's one of the very vital things to look into. So when menstruation ceased, doesn't come, then PCOS could be responsible. Then not only that, dysmenorrhea, which is a painful menstruation. Menstruation comes this time, but it comes with severe pain. PCOS could also be looked into. Then we have what we call abnormal hair growth. When you see some women, some can develop beards. It's one of the first symptoms of PCOS.
Continue.
Because, okay. The reason being this, we have a particular hormone in the body, we call it androgen hormone.
That's the name.
Which is men's hormone. Though women also has it. But women convert that hormone to what do we call estrogen. And estrogen is very responsible for fertilization. Men convert their own to testosterone, which helps for sperm production and the likes. So when you're now having an excess of estrogen, maybe the conversion rate is very low. So thereby your body will be having the excess. It's just like we're talking about diabetes now. So when your body is not having the excess of it in the body, which means you'll be having the kind of male appearances. Your voice could change. You could experience a kind of abnormal ear growth where you're not supposed to have it. You can have facial hair, especially. Then your body mass could be different or be developing in a way that you will realize that it's still to the male side. So those are some of the symptoms of PCOS. And at the same time, infertility. It could lead to infertility. After running several tests and you realize that I don't have fibroid, I don't have this, I don't have that yet. Fertility is not coming up. So definitely PCOS could be responsible for that. Thank you.
Thank you. So before we move to our next question, I want to pick you on one aspect. You said when women are experiencing painful menstruation, we can suspect PCOS. I want you to be precise about it. Is it when the menstruation is not coming regularly and each time it comes, they experience it? Because virtually let's say close to 50% of women experience painful menstruation. Some don't even have experience pain at all, but some of them feels pain maybe around the first, second, or thereabouts. I don't know how the sequence works, but sometimes we hear them feeling pain in so much discomfort. So are they a suspect for PCOS?
Can we say that can we say that every painful menstruation is caused by PCOS? Is that the question now?
Yeah, let's speak it out.
Well, no. The reason being this, or let me make it very simple. For anything that goes wrongly in the body must give a signal.
Definitely.
And the signal is what we call symptoms.
Yes, sir.
Sometimes we talk about sign and symptom. They are different things. Sign is what others see in you, your healthcare practitioner, what they see in you. When they examine you, that's a sign that manifests. But symptoms is what you yourself are experiencing. That is symptoms. Now, we can't say, or we can't actually say every painful menstruation is caused by PCOS. No. But can also cause or can be a reason. I've seen the situation whereby a young lady of less than 20 years, whenever she wanted to menstruate, she must be on drip.
Just imagine.
So that goes beyond normal pain now. We are talking about severe menstrual pain. So when it's becoming too alarming and too frequent, then PCOS can also be looked into. Yes.
Then you talk about those who had beards, had excessive growth of hair. I've seen several women with growth of beards. I even saw one on this very Sunday, but this Sunday that we just passed.
Okay.
I was at a church and I saw that woman. She was very hairy. So and also she's obese.
Okay.
But I know she's with child and co. She has children, she's married. So can I say that, can we say that she is also a carrier of PCOS, like she has a trace of it? For her to be so hairy,
Okay.
I've seen quite a few, a lot of them, even while going on, you meet them on the road, you see them, you can either see beards here or some on their chest. It's quite obvious.
No.
Okay.
I think I should make it simple by doing this.
Okay, sir.
Sometimes sicknesses present the same symptoms.
All right. Yeah.
Okay, let me give this illustration. If someone is stressed,
Yes, sir.
you're overstressed, you can have headache.
Headache, yeah.
If you are hungry, you are not eating, sometimes you can have headache.
Yes, sir.
If you are hypertensive, your BP is too elevated, you can have headache.
Of course.
If you are hypotensive, your BP is low, you can have headache. If you're having low sugar, you can have headache. If you have so several things. So for the fact that medical is very complex one. So for the fact that you are showcasing a symptoms related to one ailment does not mean that you are experiencing it. So several things could be responsible for someone growing hairy hair.
Yes.
Number one, it could be genetic.
Definitely.
Maybe in their family, it's their trait. So you may not have PCOS, yet you're having the symptoms of it.
I understand.
Then not only that,
Maybe it is recessive.
now you're talking.
Okay.
So that is why sometimes I don't buy the idea of when, because it's very common among our distributors. So you can just pick a phone call now and say, hello, am I talking to KEDI member? Sorry, I'm having stomach pain. What can I use? And some distributor maybe can, let me say, maybe due to lack of understanding or proper understanding, they will start recommending. No, that is wrong. 2 days ago, I experienced something in my office. A man came. He was complaining of stomach pain, serious one. And I asked him since when. He said the pain comes and also goes for the past 5 years.
Wow.
Okay, what have you been diagnosed of? She said, I know I'm having ulcer.
That's what
So I just want
say.
I just want to buy some of your product that can cure ulcer. So the next question I asked, then how did you know
that you have ulcer?
that you're having ulcer? So it was like, this is the first time someone will ask me such. I said, well, for me to believe you're having ulcer, we need to diagnose you. So during the consultation, I examined him rather. I suspected this is not an ulcer symptoms, even though they are very similar. So I gave him a paper to go to lab and run some tests. And lo and behold, when the result came out, this one was not even having anything called ulcer.
Just imagine.
And he has been consuming Jecrol, antacid for the past 5 years.
Imagine.
The only thing he has was accumulation of gas in the stomach. So sometimes diseases can present the same symptoms.
Of course.
So, but for you, because they know you know more than them, I believe that is why they come to you.
Exactly.
So, because sometimes someone can be using the right medication to treat the wrong. So, it is wrong to actually say that, oh yeah, buy this product, it works for this. No. You need to do proper consultation to establish the fact. So, a woman growing hairy hair cannot actually mean that the person is suffering from PCOS.
Yes, I get it. Thank you so much. Thank you so much. All right, that takes me to our third question, sir. We know, like you have said, PCOS is very common, even according to our statistics of today. Yet, so many women go undiagnosed for years. So, in your own opinion, why is PCOS often underdiagnosed, and what are the likely causes of PCOS?
Number one, I will say lack of awareness.
Yes, sir.
Then number two, I will also, the awareness is in two forms. Number one, from the government side, like what we are doing now, we are creating awareness.
Yeah, just like we said in our
because
introduction.
People, this is their first time of hearing a disease called PCOS.
Exactly.
So two, self-awareness.
Okay.
The
first one is like general
awareness. Right?
All right.
The second is self-awareness.
Yes.
Individuals should be so cautioned about themselves to the point that when something is wrong, in your body, you should know.
Of course. If you feel something, that will be a sign will present
Because,
itself.
yes, but these days we are too busy, so very busy for others and forgetting ourselves.
Busy
we are
for
so
others.
So
Oh,
busy.
forget ourselves.
Yes, especially among the men. But don't let us go there. Anyways. So no matter how busy you are,
Yes,
that's my point. Create time for yourself. And creating time for yourself starts from your health.
Yes, sir.
You should be well observant. For instance, some men, they don't even know, anyway, we are in public, some men does not even check mirror. Let's look at that.
Okay, let's start from there. Yeah.
I've seen a situation where there was a time I traveled to Ilorin with one of my colleagues. So a man was walking towards us, and I was telling the man sitting beside me, I said, this man is having spondylosis. Yeah, spondylosis. What is spondylosis?
Okay.
And this man is having back problem. But the man was not even aware. So that my man that was
your colleague with you,
he called on him and said, "Sir, are you having back pain?" He said, "Yes." He said, "But this man said you're having a problem." He said, "How does he know?" But the way he was walking, he bent. But to him, he didn't know. So when you are not so cautious of yourself or aware, something may be wrong without knowing. So I think that is the first thing first. So being underdiagnosed simply means you don't know something is wrong, yet something is wrong. That is one. Two, going for routine checkup is very, 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 very important.
No, we are still talking about why is it so many? Why is it so rampant?
It is rampant because people are not aware of it.
Okay.
Then it's also so rampant because people doesn't go for routine checkup.
Okay, sir.
It's only in this part of Africa or Nigeria I realize that the only time we go to clinic or we go for checkup is when you have symptoms.
Is that when we break down?
Some even until when they are broke down.
Exactly.
No. Using hypertension as a case study,
of course.
You know, one of the danger of hypertension is that it presents no symptoms at the onset.
You wouldn't know.
You wouldn't know. But in the long run, you will realize that this has gotten so dangerous. A week ago, I attended to a man in my office. He came for another thing entirely. So when I checked his BP, he read 200.
Sure.
So I told him, "Sir, you can't go now, you have to rest." He was like, "But nothing is wrong with me. It's just like that." So that is why sometimes you see people driving their cars because they have heart attack or cardiac arrest, and from there they pass. So first thing first is to be aware of yourself, then take your health serious by running a routine checkup.
All right, you said by running a routine checkup, we should be aware of ourselves, general awareness, and also self-awareness. These are many of the reasons, few of the reasons why PCOS has become undiagnosed for many, many years. That takes us to our next question, sir. What lifestyle changes are most effective in managing PCOS? I know you're almost tilting to that. I want you to just tell us more now. What are those lifestyle changes that you believe and you know very well with your own clinical experience that they are most effective in managing PCOS?
Number one, I will say that know your medical family history. Okay. Because one of those things that causes PCOS is it is genetic. It is genetic. If family, or especially from the mother side, has it, there is tendency that the children, especially the first generational children, such parents will give birth to, may also experience it. So many people just move around and without being aware of what their family is suffering from. Let me give you a case study. I attended to a girl, I can't call her a lady. She's less than 20 years of age. She has cancer of the throat. So when she came for consultation with inquiries, I realized that the grandfather died of cancer. Though a different cancer.
Well, at least there is a cancerous cell in there.
The father died at the age of 40-something years. Cancer.
It's becoming genetic.
Now, the first daughter does not have it. The second does not have it. The third one has it. So, because they were not so more, they are not so aware that it seems this thing is running in the family, so they just live their life anyhow. So PCOS, sometimes when you hear that my parents died of a disease, the uncle in the family to died of a particular disease, make a finding. Is it a genetic disease? Because by the time you are aware of that, you'll be able to caution yourself or know the next thing to do,
even before
to prevent.
Once you know that the grandparents died of this particular disease and the parent died of it, someone should also put yourself in the check.
Sir, you will not be surprised. Some children are not even aware of the kind of ailment their parents experience. They are
Some parents don't disclose.
Experience. So if you don't know the kind of ailments that killed your parents or your parents are experiencing per se, then how can you prevent yourself from having it?
That's true.
Especially if it is genetic. So I think that is the first thing. Then 2 is to limit our stress. Nigeria is already stressed. In fact, everybody is stressed.
In this Nigeria, Lagos precisely.
And if you're talking about stress, some people assume we are talking about people that work with physical power. No. Stress is of 2 types. We have people that are stressed by physical activities. They do strenuous work. We have what we call mental and emotional stress. Run away from anything that can affect you mentally. And have a self-awareness that it is when you are alive, things are wrong. When you are not there, things will stay wrong.
Absolutely.
So take life easy. Because when you overstress yourself, body releases what we call the cortisol hormone, which is a signal hormone to every other disease, especially PCOS. Because like we said, it's a metabolic disease. So stress is one of the ways, managing your stress is one of the ways that we can use to curb or to manage PCOS or to prevent it. Send your children to the school you can afford the school fees. If paying children's school fees becomes a burden, then change the school. If don't do copy. That's because some people by themselves for themselves, they cause problem for themselves. For the fact that your neighbor stays in 2-bedroom flats and is paying convenient does not mean you can afford it. Everybody knows what he or she is doing to raise money or to make money. So for the fact that your neighbors are sending their children to the best private school in your area does not mean you should do that. Do what your capacity can carry. Don't give yourself unnecessary pressure or unnecessary stress. And when you can able to curb that, I believe it's one of the ways we can curb PCOS. Then be mindful of what you eat. Food can cure us. It can cure. Food can also cause sickness. Because if you eat wrongly, your body will meet it there. You can't cheat this body. And the funny part of it is that you may be doing something wrong for the past 5, 10, 20 years. The body will not ask for it then. It is when you stop doing it, then the repercussion comes. So either you stop doing it or you don't stop doing it, the repercussion will still come. So be mindful of what you eat. Be mindful of how you eat. Be mindful of when you eat.
What you eat.
Be mindful of what you eat, how you eat, and when you eat it.
That thing.
Because sometimes you can eat the good food, but you're eating it at the wrong time. Because some people are so conversant with eating late food. So and so on and so forth. So if you can, I believe strongly, if we can caution those 3 aspects, our lifestyle especially, what you eat, your family history, be very cautious about yourself, and don't give yourself unnecessary stress. So I believe it's one of those things that can help in managing or preventing PCOS.
So this very question that you asked us you now, there is another part of it, which is, can PCOS be cured, or is it a lifetime ailment?
Okay, I will answer that in 2 forms. My own personal opinion. I believe we don't have incurable disease.
So to you, every disease is curable.
Yes, we only have incurable person. We don't have incurable disease. You know why I said so? Because some disease that has been proved or proven that cannot be cured, some people have been cured of it. I have seen people being cured of HIV. I have seen. I'm not saying.
They are still alive.
Yeah, of course they are still alive. Being cured of it. And several people believe it cannot be cured. But when you know what your body needs, you give it what it needs, and you follow guidelines and instructions, you can still be cured. You know, some years ago, some diseases these days, let's take malaria for instance. When malaria was first detected, they believed there was no cure for it. A lot of people died of malaria. But research was going on underneath gradually until they find a cure.
Yes, sir.
I don't know if you are getting my point. So, but for the fact that a specific disease is not yet being cured, or the cure has not been found now, does not mean it cannot be cured. That is why I said we only have incurable persons. We don't have incurable disease.
Right.
Two, in medical terms, currently there is no cure for PCOS. I believe I made it clear now.
Yes, sir.
Currently there is no cure, but it can be well managed to the point that the symptoms will no more be there.
Okay. And the person will be able to live
Of course, yes.
Do everything that someone without PCOS is
can do. Of course, yes. But that comes with a clause, because that means you must live your life with caution and carefulness. No, like the general says, which says prevention is better than cure. So if you can't prevent, now it has occurred, then you pay the sacrifice of management.
I get it. Wow, this is really, really massive. So that takes me to my next question. But before then, please, for all of us watching, if you have any question, please do not forget, keep dropping them in. Very soon, I'll be turning to the comment section to pick our questions, our contributions, and for us to, like we said, we need to share minds and rub minds together, share knowledge, learn from each other. So please keep dropping in your question. Very, very soon, I will turn to the comment section to pick, to read out our questions. So this takes me to my fifth question, sir. At what point, sir, will you agree with me that PCOS is a lot? Like, is a lot physically, is a lot emotionally, and so on. At what point will you say that PCOS is a lot?
At every point.
At every stage of it.
Of course, because there is nothing like a small disease or a big disease. Disease is a disease. And it's only those that are experiencing it, they know that it's a lot. So I can say it's a lot because let's look at the merely headache. This one is having a headache, everything about your system
Just turn around.
will turn around. So how much more? Because it's an hormonal disease, it affects everything about you. Because one of the symptoms is being obese. And when you are obese, it can affect your self-esteem.
Of course.
It can affect your, even the way you talk. It will be as if everybody is looking at you in the wrong manner. Then it affects menstruation. And when that happens, people will feel worried. Also, it can affect your fertility rate. That one is even inevitable. Because people that suffer infertility, they are passing through a lot.
Of course.
So at every point, I would say it's a lot. So the best is to prevent it. And if you're already experiencing it, come to KEDI. You will be well managed. And you'll be very okay.
All right. So what are your words for people like that? What are your words for women currently dealing with PCOS? What are your words for them?
It is not the end of the world. Then sometimes God gives small battle to big soldiers to learn lesson. And sometimes God gives big battle to small soldiers so that you become big. So whatever or whenever you're experiencing now, whenever it has started, realize that it's not the end of the world. It comes, it will go.
Sure.
So far, you are doing what is right at the right time, and you are doing it right, then you'll be okay.
All right. Okay, like I'll pick you up from your last statement. You said that for women who are in this, they should do what? They should this is not the end of the road. They can come to KEDI and they will get better. All right. So finally, sir, as a renowned KEDI consultant with many years of experience in TCM, especially in KEDI, so which KEDI product would you recommend for someone dealing with PCOS? And as you recommend those products, tell us the recommended dosage rates, and you can also share your experience, the level of the effectiveness of these products you want to recommend.
Well, number one, talking from the effectiveness, KEDI products are very wonderful.
All right.
Very, 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 very effective. And to mention the product, the first I will mention is Golden 6.
Okay.
Because we are talking about hormonal disorder. And one of the major functions of Golden 6 is to balance the body hormones. So Golden 6 helps a lot for people suffering from PCOS. 2, I will also recommend Gynaphan. Because we are talking about gynecology disease now. Then 3, I will talk about Golden Hyphen, because we are talking about inflammation, swelling. And Golden Hyphen works for anything abnormal growth in the body. Then I will also recommend Reishi. That make it 4.
Yes,
and the reason for Reishi being that sometimes when someone is suffering from ovarian cysts, ovarian cysts could be as a form of PCOS. Because PCOS can cause ovarian cysts, but ovarian cysts cannot cause PCOS anyway.
Okay.
But PCOS can cause ovarian cysts. And when someone has cysts, bacterial or viral infection is not inevitable in the ovary. Therefore, Reishi will also come in. So those 4 first. Now, what is the next symptoms the person is experiencing? We now determine what next product will be taken. If the symptoms is amenorrhea, like the menstruation of cyst, then we talk about hips comfort now. But if not that, maybe it comes with pain, then we can talk about jointis pain, which also helps for pain. Then if it has leads to infertility, we can talk about M&B woman, which is very good for women. Then we can talk about cardiac because of the vitamin E, so on and so forth. So there are several KEDI products that can work for it, but from the onset, Golden 6, Gynaphan, Reishi, and Golden Hyphen are very important.
All right. Thank you so much. Without wasting our time, I would like to rush down to our comment section because our time is fast spent, so we need to read through a few of our questions. I have here from our Instagram page from Mrs. Tayo Adolipekun. She says, what are the tests used to diagnose PCOS?
Okay, we have several tests to confirm PCOS. In my own view, I will recommend up to 3. 2 to 3 tests. Okay. Number 1 is to do what we call hormonal profile test.
Hormonal profile test?
Yes.
Okay.
When you go to the lab for hormonal test, it will let us know what type of your hormones is abnormal.
All right.
It could be LH hormone, which is the luteinizing hormone. It could be follicle stimulating hormone, or so many other things. Okay. So the first test I will recommend is hormonal profile test. Right. 2, I also recommend a pelvic scan. Okay. Because like we said, PCOS can cause inflamed ovary. Exactly. So and when the ovary is inflamed, the only way to confirm or to know that is to scan. Yes, sir. So you can do pelvic scan, you can do ultrasound, and so on and so forth. All right.
So hormonal profile test and also this pelvic scan.
Yes, sir.
All right. So then how can PCOS be prevented? That's the same person is asking us. How can PCOS be prevented?
Well, I believe we've discussed this. Number 1 is know your family history. If PCOS runs in the family, start prevention before you start experiencing it. That is 1. 2 is to abstain from stress or anything that can aggravate the high production of cortisol hormone, which can lead to PCOS. Then at the same time, at any slight symptoms you experience, go for checkup. Okay. Even with or without symptoms. Because prevention is better than cure, like you said. Exactly. And the best way to prevent is to do tests. So when you run the test on yourself frequently, then you should be able to know one. And then be mindful of what you eat. Like you said. So in order to avoid repetition, be mindful of what you eat. Don't stress yourself, and so on.
Wow. All right. Also from Adisadeli, also on our Instagram handle, he has a question. Says, what is the difference between PCOS and ovarian cyst? You
I think
mention of that
mention of
very
that.
briefly. So you can talk about it again for him to know.
If you're talking about PCOS, like I said earlier, it is an hormonal disorder. It is when the hormone in the body is disorganized.
Yes, sir.
Then it brings some symptoms. And one of the symptoms PCOS can bring is ovarian cyst. So what do we call ovarian cyst? Ovarian cyst simply means abnormal growth in the ovary, which could be caused by PCOS.
Okay. So,
but it's not the only
which is
thing.
the first stage now? Which is the first stage?
Like when someone is having PCOS?
Yeah. Is it the ovarian cyst that comes first?
No.
PCOS that?
No, PCOS must come first.
That's when that triggers
ovarian cyst.
Okay.
But it is not only PCOS that can cause ovarian cyst.
Okay, sir.
Several things could be responsible for ovarian cyst. It could be due to bacterial infection.
Okay.
Because whenever there is presence of bacteria in the ovary, it could cause a cyst. Then it could also be a fluid, like water. It could be blood.
Yes.
So several things can cause ovarian cyst.
Okay.
But PCOS is one of those things that can cause ovarian cyst.
Okay.
Ovarian cyst simply means inflammation of the ovary.
Of the ovary. That's the difference.
That's the difference.
Inflammation of the ovary for ovarian cyst.
So ovarian cyst is not caused by hormonal changes.
All right.
Alone.
Okay.
But PCOS can cause ovarian cyst.
All right. Thank you so much. Indeed, this has been a wonderful, insightful edition of Talk to KEDI. If you're just tuning in, this is Talk to KEDI, and indeed, our guest, Mr. OPEYEMI AKANO, has exhaustively discussed what PCOS is and everything about PCOS. Thank you so much for tuning in. Before another question comes in, I would like Mr. OPEYEMI, I would like to ask you this question, sir. Initially, we are talking about irregular menstruation, which is part of the symptoms of PCOS. But I want to ask, because you said PCOS there is infertility linked with it, because once you are a carrier of PCOS, you will surely experience infertility. But I want to ask, someone that has consistent or steady menstrual flow, can the person still experience infertility too?
Of course, yes.
So in that case, it is no longer PCOS; it's another cause entirely for the infertility.
The analysis here is this: for the fact that someone is having a frequent menstruation does not mean that does not mean that she does not have PCOS.
So I want to get that analysis quite
it's
well.
Sometimes, like I said earlier, when the disease comes in, individuality, we have our differences. The symptoms I may present may be different from the symptoms you will present, but we're having the same disease.
Wow. Not like the symptoms is general for everybody.
Let me put it this way. A disease cannot present a singular symptoms. That's where I'm trying to drive at.
All right.
A disease may not, let me use that word, may not present a singular symptoms. And aside from general symptoms, we also have individual symptoms.
Okay.
I may be experiencing PCOS, and my symptoms is that I am having painful menstruation. Even though I'm menstruating, but my menstruation is painful, severe. Someone else may also have a PCOS, and is not menstruating at all. I don't know if you are getting my point. Two, another person will be having PCOS. She's menstruating, but she's not ovulating.
Menstruating but not ovulating.
Another person will be having PCOS, menstruating, but fertilization does not occur.
Which is deep. Okay.
So all of us are experiencing the same thing. We are having the same sickness rather.
Okay.
But the symptoms we are presenting is different. So that is why running the test to confirm what exactly are you experiencing or your body is passing through is the first step towards healing.
Wow. Okay, sir.
Because the symptoms may be general, it may also be
specific to
myself.
Okay.
And when it occurs, then I may not know what I'm experiencing with that test.
Yes, sir.
And that was why I used a case study of headache.
Mm.
I may be having malaria now. I may be having headache due to malaria. You may be here having headache, and your own headache may be due to stress.
Yes.
So I can't just say that headache is caused by malaria.
Yes,
no. Several things could be responsible. So menstruation could be as a result of PID. It could be as a result of a blockage of fallopian tubes, tuber blockage. It could be as a result of fibroids, myoma in the womb. So several things.
Right.
So running the test to confirm is the first thing.
Okay, thank you so much, sir. The same person, Mrs. Tai, I don't know, still asking that won't golden cysts increase the growth of the ovarian cyst and fibroid?
Okay. Well, we are not talking about fibroid.
Yeah, we're talking about PCOS.
We're talking about PCOS.
So she's asking that you prescribed golden cysts as one of the fundamental products to use.
Golden cysts cannot help ovarian cysts to increase.
Okay.
The reason why the ovarian cyst was there in the first place is due to the abnormality of the hormone. I understand the question because we always tell people that don't recommend golden cysts for people that has fibroid.
Okay.
So fibroid and ovarian cysts are not the same. And fibroid and PCOS, they are not the same. So what causes fibroid is different from what causes PCOS.
Okay.
So the causes of PCOS, like we've said, is hormonal changes, hormonal imbalance. And what can help in balancing the hormone is golden cysts.
Oh, yes.
Then we shouldn't forget that it's not only golden cysts that such a client will be using. It goes along with some other products like golden ifan and reshi, which helps to battle the cyst
in the ovary.
Yes, it is not the golden cyst that will do the work in the ovary. His own duty is to balance the hormone. The golden ifa and the reshi are the one responsible for the cyst, for the swelling that already taken place. So it won't affect.
All right. Thank you so much, sir. Indeed, we are. This topic is really shaking ground, honestly. And thank you for your time. Thank you for the information shared to us. So very briefly, I would like it's time for us to take our Dr. Cap health tip. So please, sir, could you do us the honor of reading out the Dr. Cap's health tip for this edition?
Okay. Dr. Cap's health tip says, PCOS is not the end of your journey. Rather, it's a call to charge of your health by listening to your body, seeking help early, and making consistent lifestyle changes. You can thrive and live a healthier life.
With that, it is a wrap on this edition of Talk to KEDI. I hope you have learned something valuable today about PCOS. Special thanks to our wonderful guest, Mr. OPEYEMI AKANO, for taking time to share with us from his wealth of knowledge. In case you joined this broadcast late, don't worry. The full video of this edition will be on our Facebook page at KEDI Healthcare Industries. Also, you can check our Instagram handle at KEDI Healthcare_official. Also on our YouTube channel at KEDI Healthcare. It will also be on our mobile application, KEDI Care App. Feel free to watch and share with your loved ones. And don't forget to join us for the next edition of Talk to KEDI because it promises to be insightful. Thank you so much for tuning in. Until I come your way next time. Bye for now. I remain Felix Adedoyin.